Welcome everyone to the MPHA Tribal Tobacco Use Project presentation today by Mac Hickey. My name is Mary Grand and I'm MPHA's Executive Director. We have our typical Zoom housekeeping reminders. I'll let you read. We've got a great session today, so we want to get into it right after we read our ancestral land statement. We ask that you take a moment to honor and acknowledge that we are on the ancestral homelands of the Dakota and Anishinaabe. Indigenous people have a long-standing history and connection to the land since time immemorial and are the original stewards of lands and waters. Many American Indians were forcibly exiled from their lands because of aggressive and persistent settler colonialism and US governmental policies, but they persevered. We make this acknowledgement to honor the Dakota and Anishinaabe people, ancestors and descendants, as well as the land itself. And I'd like to have MPHA's engagement specialist and project manager on our racial equity and advocacy group, one of the two, Emily Akers, introduce our speaker for today.
Thank you, Mary. Hi, all. We're super happy to have you. And I am super honored to introduce and welcome Mac Hickey, who will be presenting on this awesome topic. So Mac, I'm going to let you take it away.
All right, thank you, Emily. Let me get the, all right. You guys can see that so far. All right. All right. So yeah, first off, feel free to send anything in the chat, questions, emojis, reactions. I'm here for it. But today I'll be talking about the Tribal Tobacco Use Project 2. So an overview on both the burden of commercial tobacco use and the strength of traditional tobacco use in Indigenous communities. All right. Yeah, so this was the ancestral land statement, but we already went through that. But so today I was thinking that we'll all learn about the background and mission statement of American Indian Cancer Foundation, and I'm going to go by ACAF for short. So that'll be the two acronyms I'm going to be mentioning for short. And the importance of community-informed data collection within the sphere of cancer research, which we're talking about TTOP, the Tribal Tobacco Use Project. And we should be able to differentiate between commercial tobacco and traditional tobacco within tribal communities and some historical context surrounding the burden of commercial tobacco. And we'll be able to understand the development of Tribal Tobacco Use Project 2 and how it plays a role in data ownership within tribal communities. And we'll be able to identify different survey and sampling methods used amongst tribal communities and learn about unique challenges presented within urban and rural communities as well. So yeah, just like a quick overview of the presentation and do an introduction on ACAF, commercial tobacco usage problems amongst American Indians, traditional versus commercial tobacco, and the background of the Tribal Tobacco Use Project, specifically more on TTOP 2, then the methods that we use for TTOP 2, results and limitations, and then at the end I'm going to mention about further considerations on a future for Indian country that is commercial tobacco free. And then at the end, we'll have time for Q&A, hopefully. So about me, I'm an enrolled member at the Lac du Flambeau Band of Lake Superior Chippewa Indians in Wisconsin, or otherwise known as Ojibwe. I was born and raised in Apple Valley, Minnesota. I went to school at the University of Iowa, but came back here. Here I am back in Minnesota. But I also wanted to take the time to more than just introduce myself, and that this project was like an exploration of my identity a little bit. So growing up Indigenous, issues didn't go unnoticed. I noticed like family members, a lot of them became sick with various forms of cancer. And I saw that health was something to fight for. And it's an honor and privilege to work at ACAF. And I feel like it is a setting of wrongs to the right for my ancestors and ancestors to come. And so far, my experience with the Tribal Tobacco Use Project, I was able to make friends, extend kinships with people I've known before, because our community is so together. And yeah, and just learn more perspectives about myself and as an Indigenous man within the field of public health. And the cancer burdens do affect my people. It's prevalent within my own family and families everywhere. And TTOP 2 was a critical step to like shining visibility on longstanding issues within our community. So currently, as I said, I'm a research coordinator at ACAF. I've been working at this organization for over a year. So I would say since March of 2021. My main focus in this organization is data collection and community engagement among tribal nations that we work with, specifically when it comes to the work with TTOP. And I also volunteer at the Department of Indian Work. I've made numerous connections there, friends, and help with food shelves and stocking the shelves as well. And just love to serve my community in that way. And as some of you guys may know, I'm part of the MPHA leadership development cohort team, which I'm thankful that you guys have me on this platform. And then this is a picture of the one on the left is of Powwow for Hope in the back. And then the one on the right was our Celebrate Indigenous Life. And both of those were ACAF sponsored events. All right, so a little background on the American Indian Cancer Foundation. For those who may not be familiar, we were founded in 2009 and became operational in 2011. And we were established as like a national nonprofit to address tremendous cancer inequities in our communities, relatives that we face. And we have a mission to eliminate cancer burdens through education and improve access to prevention, early detection, treatment, and survivor support. And then, yeah, at ICAF, we believe Indigenous communities have the knowledge to identify and develop solutions to the problems that they're faced with and are often just looking for the support to make those solutions a reality. TTOP is an excellent example of this. There's already so much work within the community, and we want to work with the already established systems and lift the knowledge and successes going forward. Right. And then, yeah, though, this slide further represents the organization's division of our work and capacity. We currently have 4 different types of teams that embody the mission at ACAF, all of which are a component of cancer prevention and early detection. Our cancer equity team was our first team that has a strong focus on working with tribal healthcare clinics, such as IHS, which is Indian Health Services, and other services working with American Indian, Alaska Native communities. The second team we had was a prevention and policy team, which educates and helps write policies for tribal communities and is a huge part of the resource development within Indian country and is culturally tailored and tribally specific. And then the team that I work for is a research team. We focus on research methods, data collection, and funding opportunities. And then recently we added a new team, the evaluation specialist, to our team, which expands ACAF's capacities to evaluate program efficacies in tribal communities and coalitions. So I would say that you can think of it as like a translator to articulate tribal success to Western academia and et cetera. So here's a graphic that was developed by our prevention and policy team at ACAF. We understand the need to assess our way of life as Indigenous people and when starting any initiative to our research projects. And our worldview as Indigenous people has always been non-linear compared to the Western worldview or Western academia. And this can be understood in how we view time, resources, research, and even life. And a huge symbol of this is a circle rather than just a straight linear, timeline. And circles are a guiding principle in not only my work, but my personal life. And I believe in respect for all living things, Mother Earth, people, and people in indigenous worldview into our interrelatedness, balance and sustainability, and lifeways are rooted in culture and grounded in respect for all living things. So here's a graphic that we commonly use in a lot of our brochures at ACAF, and this is a common shocking statistic. Although it is getting old, as you can tell, it's from 1990 to 2009, there is still a trend of significant disparities within cancer death rates amongst American Indians compared to white, just the general white population. And when tackling like any of these health issues, we usually need to start with this data, and we need numbers to inform the work that we're doing. And unfortunately, there has been a struggle in Indian country due to small sample sizes, racial misclassifications, etc. And the report shown here is brought to light, alarming the inequities in cancer incidences and mortality facing our American Indian population. And they address the correction of American Indian misclassification, and the resulting data shows how cancer incidence and mortality rates vary by tribe, region, gender, and alarmingly higher than non-Hispanic white people, as previously mentioned. And over the past 2 decades, substantial progress has been achieved in reducing cancer mortality among whites, but less progressive has been achieved for American Indian, Alaska Native populations. In fact, our mortality rates are still increasing, unfortunately. And then here's a quote from the historical context for commercial tobacco usage from MDH. Health inequities are directly linked to determine and deliberate efforts of US, federal, state, and local governments to uproot American Indians from their lands, eradicate their languages, and destroy their ways of life. And I thought that quote kind of tied in with what I was going to expand more about, going forward with this slide and forward with that. I was just going to mention, like, this isn't a presentation on Indigenous trauma, but I thought this would be like important to mention. So like the work at ACAF is focused on Indigenous strength and resiliency while recognizing historical context. An important disclaimer, the topics like our trauma is extremely sensitive to discuss. And trauma in American Indian communities is evident in both historical and current contexts. Trauma that we have is evident in many forms of violence. And as a result, we as Indian people succumb to addiction at rates that far outnumber the general population. We have enormous challenges around healing our spirits from historical trauma and from resulting addictions, and often leading to additional trauma, unfortunately. And when a person is addicted to a substance such as commercial tobacco, the substance itself loses its spiritual value. And we have had lack of access to traditional tobacco such as red willow and sage, which I'll mention a little more down the line in this presentation. But our traditional practices were made illegitimate, illegal, and illicit. And I'm going to take the time to acknowledge the history of this, because the history is why, like, I'm able to sit here before you today and talk about commercial tobacco. And while devastating, health outcomes for Indigenous people is entirely determined by history. And acknowledging that these systems historically and continually impact the health of Indigenous people is the first step. And we have to work together. The work is about reclaiming a strong and healthy future for our generations to come. And so going forward though, like the historical context a little bit for loss of traditional Indigenous cultural knowledge has been prevalent as of recently. And for more than 100 years, federal policies have tried to terminate the unique legal political government to government relationship between Native tribes and the United States government. And these moves had a negative impact on Indigenous people and destroyed communities and family bonds. And Native children were separated from their families during boarding school era, and they were deprived of our teachings and traditional ways of knowing. And from the 1800s through the 1960s, government military style boarding schools and church ran boarding schools were used to assimilate American Indian people. And children were forcibly removed from their families to attend schools far from the home that they were punished for speaking their language, practicing spiritual ways in a stated effort to, quote, kill the Indian, save the child. And many children died from infectious diseases from these boarding schools. And in many schools, like physical and sexual abuse by the staff was rampant. And boarding school survivors were taught that their culture, where it was like inferior or shameful to the rest of the population. And this still affects many American Indian communities today. And children were stolen from a reservation at a young age and sent to a Christian institution on boarding school, lost some or all sense of their self-worth, and that is connected to their native culture and tradition. And in the early 20th century, Indigenous people were ostracized from their traditional ways. They're devalued to public policy and procedures within social institutions. And as a result, like ceremonies, which included the use of traditional tobacco, were conducted in secret, and native languages were spoken only in homes or private places. And that's I kind of want to make a point there with like us not being able to use traditional tobacco. And that's why a lot of us had to use commercial tobacco because of that. So yeah, traditional tobacco knowledge was not necessarily passed through the next generation. To be honest, I didn't learn about it until I started at ACAF. But the generation that was born from parents who attended boarding school were then less likely to be introduced to traditional tobacco. And they didn't know the difference between this and harmful commercial tobacco. And in recent generations, Indigenous people have revitalized ceremonial beliefs and practices, yet there's still a disconnect with cultural ways of the past. And commercial tobacco is commonly used in our ceremonies given the lack of access to traditional tobacco products. And I'm still going to mention, though, the federal termination policy in 1950s and 60s ended the government-to-government relationship with more than 100 federally recognized tribes. And the result was disastrous for those tribes due to the discontinued federal support, loss of land held in trust, loss of tribal identity. And most of the tribes terminated during the time where they reestablished federal recognition through the congressional process in the 80s and 90s. So there was a federal relocation policy of the 50s and 60s, sought to move American Indian families to urban areas, promising them jobs, housing, a new life. And those who struggled and stayed formed the core of growing urban Indian populations, such as like the Little Earth housing in Minneapolis. And ultimately, many families returned home to their reservations or home community. And today, many families and individuals travel between their home community and urban communities for periods of time to pursue education and job opportunities. Churches and missionaries have a long history of converting American Indian people to their religions, and in the process, often labeled traditional culture practices such as songs, dances, dresses, and artwork as evil. And today there's a diverse mix of Christian beliefs and traditional spirituality within each American Indian community. And trauma in the Native communities is evident in historical and current context for our people. The historic trauma manifests itself in forms of violence, and as a result, we as Indigenous people, again, succumb to addictions rates far greater than the general population, as mentioned before. All right. So yeah, as I was mentioning before, I was going to differentiate them, commercial tobacco versus traditional tobacco. We'll start with commercial tobacco. It's mass-produced and sold for profit by companies for recreational and habitual use. This can be things like cigarettes, smokeless tobacco, cigars, loose tobacco, hookah, electronic cigarettes or vapes, and the list can go on within that realm. But traditional tobacco, though, I would say is that to define it in Ojibwe, it's Asema, and in Dakota, I am so sorry, Wyatt, if you're watching this, but it's going to be Chinsasa. Coco, if you can put it in the chat on how to pronounce it, but that is how we pronounce it in some of our languages that we use. So yeah, the plant isn't addictive, and they don't have added substances, and typically isn't inhaled when we use traditional tobacco. Each tribe has a different relationship with traditional tobacco. Some of them think of it as a special gift from the creator, a communication tool for prayers, a powerful medicine, and an offering to show respect when asking for help. But you can also be putting it on the ground, burning it, or giving it to a family or a friend as a means for blessings and good thoughts. And it's also important to note that not every tribe has a relationship with tobacco, but we all have our own words for it. And tobacco became an important part of building connections and relationships across Native communities, historically and currently. And here's a quote from our organization: traditional tobacco, or traditional sacred tobacco, commonly known as Chinsasa or Asema, is tobacco that is used for prayer, for spiritual guidance, discipline, and protection, and that tobacco is offered to the creator to express gratitude for land, indigenous foods, water, and the way of life. This gift should be respected and used in the proper way of health and to promote generational well-being of the people. And traditional tobacco is not inhaled usually normally, and is natural, non-addictive, and has no additives, unlike commercial tobacco. And I once heard an elder of mine say that the commercial tobacco industry is the equivalent of a toddler in age compared to the teachings of traditional tobacco. And traditional tobacco has been around for hundreds of years because the United States is Indian country, and we've had traditional tobacco teachings longer than the commercial tobacco industry. And the commercial tobacco industry is extremely new and recent comparatively to this day. And now to TTOP. So background of TTOP on how it started. There was limited data available on American Indian, Alaska Native tobacco use. There must be like a balance with caution in order to not create stereotypes within American Indian communities and to protect data amongst our people. There's also national surveys such as the Behavioral Risk Factor Surveillance System and the National Health Interview Survey are not usually conducted at community or tribal levels for a variety of reasons. And that can include like time, cost, and logistics. And also these surveys are not meant to provide information on populations at these specific levels, and therefore also like lack important and significant cultural perspectives and understandings. And additionally, for populations like American Indians, there may be limited participation and underrepresentation in these data sets. And while there could be efforts made to oversample American Indians, as well as creating specific questions or surveys that are more relevant to the overall group, those participants are expected to represent at least 574 federally recognized tribes who have their own unique characteristics, worldviews, traditions, and relationships. Therefore, while this high-level data and information may be able to identify disparities among racial and ethnic groups, the usefulness for communities is to develop and implement and evaluate tobacco-related work is limited. And this can be addressed by identifying and developing solutions that are culturally relevant and community-specific with the aim to understand knowledge systems and methods of use and connection to tobacco. And then another thing that we can talk about is helicopter research. I don't know if you guys are familiar with that, but what it is in a nutshell is that researchers will collect data, just any researchers in general, disseminate it and use it for their own benefit and never contact the tribes or test subjects again. And usually do that for academic gain and their own belief. And there's a history of data ownership going to researchers and nothing in return for the tribes. And this does impact our approach because some tribes we worked within TTOP 2 are sometimes hesitant to know about like where the data is going or what it's going to be collected for. And we wanted to make an emphasis on, giving them full control over their own data and that it is, that it's all theirs. And some tribes think that there's a massive mishandling and betrayals of data. So like, for example, the Havasupai tribe and their blood sample work. So like, just to briefly talk about that, like the blood samples that were conducted in that study was for diabetes, I believe. And they were used without they use it for other experiments and really have the consent of participants to study the DNA for other studies. And also a lot of previously done studies were not all culturally relevant. They're very generalized topics, bland, and didn't get a lot of participation. So again, there are devastating impacts amongst American Indian communities when it comes to data collection. And as a result of previously mentioned betrayals of American Indian communities, we emphasize informed consent. And this presentation could be reduced into that concept of informed consent, which is trust. So here's just kind of a brief timeline. We didn't have exact dates due to COVID from TTOP process, but I thought this was a good graphic that would help depict like how we started. And we started from the top under relationship building, alignment negotiation, and approval tribal council, and the IRB, the Institutional Review Board. So I would say like if you want to categorize it, I would say the first three of those would be the planning phase. The second three would be how we implementation. And then the last two is like data analysis and reporting back to the community, which we are currently working on. And then as I was mentioning, COVID happened. It slightly delayed our data collection and our analysis and dissemination, but we're flexible and we were able to finish TTOP 2. And the inner circle is a continuous process from our community oversight group and partners on our guidance on TTOP. And then transitioning to the survey itself. So depending on where the data collection, where we were collecting data, we would have asked their tribal affiliation or if they identified as American Indian. So tribes used either enrollment lists or clinic lists, and tribes would use these for who they would want to participate in the TTOP survey. It was more randomized, but we would also ask about like education, housing, their age, and all this is important for like secondary analysis that we do at the end of our data collection. And then again, kind of reiterating for the tribal data information, because there's two categories. There's the urban and tribal implementation that we had in our study. We did survey people who were enrolled in some communities, but some other tribes went with clinic list or invited all lists due to the small community populations. And we didn't require their enrollment card. We just wanted their verbal confirmation if they identified as American Indian. And this wasn't coming from like a blood quantum standpoint that like blood quantum mattered to us or certificates of enrollment mattered, but instead it was to gain the trust of the community. And urban data collection had, we're a little more lax because we didn't limit to one tribal affiliation or any specific lists that were given to us. And then, so yeah, e-cigarettes, they weren't in our previous survey, and the Tribal Tobacco Usage Project won due because they recently became a little more popular and they've been developed a lot more since then. And we asked about cigars. We had questions on smoking cessation. So like info about like quit attempts, the amount of times an individual may have like relapsed, and methods they use to try to quit. So like counseling, prescriptions, patches, medications. We asked like what kind of medications too, if they took them. So like Chantix or Wellbutrin. And we asked about the health providers that they were eligible to receive, such as if they were insured or able to receive care at a IHS clinic, Indian Health Services. And we asked about ceremonial or traditional tobacco and how they used it. And we asked about the secondhand smoke exposure. So like in households or in the workplace, like how often they're exposed to secondhand smoke. And we asked about beliefs about secondhand smoke, like for example, like in casinos, if they think that there should be indoor smoking, or if this should be like a hybrid, like where they go into, if there's a smoke-free room or something like that. And then finally, we had some general questions about their physical health and mental health and their activity and diet as well. But yeah, no, those questions weren't too extensive. We just mentioned like, if they had any pre-existing condition or if their mental health has been good in the past 30 days. And then the activity and diet was just asking like if they had fruit, how many servings of fruit they had yesterday or vegetables. And and then also like ask like how active individual was. And usually they were like open-ended questions for those ones, but most of the survey was definitely multiple choice. And then the sampling methods that we used, I was mentioning that we had tribal communities that we surveyed on and urban community. And to start out with the tribal communities, it's a little more complicated, but there was tribal enrollment lists. They were comprehensive lists of all tribal citizens enrolled in each Indian native tribe. And clinic lists are lists that like an IHS has the keep record of who can utilize their services. And we were given either one of those two lists from various tribes. And this was identified as random sampling at the time. And again, we picked one of the two. We went to the tribal coordinators in the community from who we knew before and selected a random number from these lists on who was eligible to participate. And then we had to change some sampling methods due to COVID. Some tribes didn't get done in till after COVID, which became very challenging. So we had to switch up some sampling methods to convenience sampling, or otherwise could be known as quota sampling for some of these tribes. So we just picked whoever was eligible to take the survey then. And we would go to like events such as like powwows or other events tabling. And then we had a urban community sampling. This one was very challenging from what I could recall though, but they didn't have an enrollment list due to like we're not like on technically on like a sovereign nation or tribal land. So we sampled people from Hennepin and Ramsey County. The sampling methods that we used was respondent driven sampling to help recruit in the urban community. So it's kind of like a refer a friend approach. And our first thought was that like we would recruit and interview one individual, and then they would recruit three people to participate in the survey. And they would be incentivized to or compensated to not only take the survey, but also recruit these individuals to take the survey as well. And they would be compensated by $5 each person that would take the survey. And the idea was that it was going to be like a snowball or waterfall effect, as I like to see it as in this graphic over here. And I think we switched to quota sampling as well once we got to the end due to some low participation. There were some things that happened, like COVID really impacted our data collection. We couldn't engage with the community in person, which is very important amongst American Indian communities. And a lot of people had a lack of access to the internet or taking phone calls for our survey, which caused many challenges. I mean, when I was trying to call a lot of people on our surveys, they always thought I was like a telemarketer or something like that. And it's hard to, get participation that way. And yeah, we were also trying through Facebook and posters, and it just wasn't the same. And it was very difficult. But yeah, again, though, some of the considerations that we had for urban sampling, it's very unique because it represents like a dysphoria of natives who came to the cities, as mentioned before, by state sanctioned programs, possibly, or which were created to eradicate our culture. And yeah, the majority of native people that live in urban cities and areas today, that this what we mean when we refer to urban natives is like a conglomerate of like native identities or people that reside in the city. And they have unique characteristics that sometimes disconnect from their own culture and also connect them to other urban natives in their cities. So yeah, also to add on though, again, COVID-19 really impacted our data collection within communities. Again, virtual challenges and lack of access to internet and technology. And the summer of 2020, 2021, I remember our community was going through a very hard time with death of George Floyd, and just that was really, not on a lot of people's mind to participate in our survey then. And we also, again, we switched to quota sampling, which are otherwise known as convenience sampling as well. And I know you guys were wanting to see some of the results, but we do stay true to our data ownership and sharing agreement, and we stay true to what we believe in with the tribes due to the contracts. But that's not necessarily like a share of the information or this presentation, but a sharing of the process and future of TTOP. And we do anticipate a statewide report in summer of 2022, which we're very excited for and looking forward to share this data in a brighter future, I would say. And currently we've been doing with TTOP, we've been presenting to community and clinic members of the data that they've been receiving, and helping them develop resources, materials, and activities. We're still in the works of making a toolkit to because they're being given a spiral notebook of just all this data that it's brand new to them. It's brand new to all of us. And our next step is to help them develop, again, resources. So newspaper ads, posts, and just what they can do to what clinics and tribal council can do to help prevent any commercial tobacco usage in the future. And then lastly, I can't reiterate that traditional tobacco is sacred to our culture, and I'm looking forward to a tobacco-free future, or at least commercial tobacco-free future. And it's a medicine. Tobacco is a medicine that's gifted to us. The commercial tobacco industry is usually to blame for what they did to the plant that had so much more meaning and power than what has been cornered into. And to close, I would like to leave you all with the following considerations for sustainable change: that there needs to exist better language around commercial tobacco and traditional tobacco. And there's a difference between the two. And commercial tobacco has massive implications for American Indian communities. And when working with American Indian communities, data ownership should be considered, and community decision-making power should be held with higher than the researchers' power involved. And resilience exists within our communities. I want to emphasize on that. And there's been so many stories shared about traditional tobacco use during our interviews. There's been laughter, connections that were created, and what I've noticed that our people are thriving, and TTOP only serves to highlight resiliency while also deferring to communities as communal experts. And TTOP can only be a singular snapshot of a community. Never is meant to be fully shaded picture of it. And it tells a story, but those details remain to be told by the people that were involved. And I want to thank, lastly, I want to thank like this year's leadership development cohort to MPHA, Minnesota Public Health Association, just for giving me this platform to speak on the community community work I've been a part of. And I also just want to thank ACAF and also just the TTOP project that we've been able to work on. And this last year, as you all know, has not been easy, or I would say last 2 years haven't been easy, like with the pandemic, and just research in Indigenous communities can be very complex and challenging to navigate. And I want to say thank you to the support that Clearway has for providing funding for our project too. And one last thing I wanted to mention is like data is storytelling. TTOP is not my story to share, but I've been given the privilege to present like in this small, somewhat surface level way. And I want to thank my colleagues, my supervisor and chief investigator of the project, Wyatt Pickner, for allowing me to share an overview of TTOP2 and its process. And it's been a long project, and I'm looking forward to see what's next. Me glitch. But yeah, is there any questions or thoughts that anybody wanted to share?
Yay, thank you, Mac. I'm gonna clap for you. And as is, I see everybody else also clapping for you. You did a phenomenal job. There are a few questions in the chat. I don't know if you want me to read them to you and then you can answer them, or if you prefer reading them. But
you can start with reading one.
Perfect. No, that's awesome. I see a lot of people are saying excellent job. You did wonderful. So one of the questions we have is, as you review the survey data, will the data show age ranges of respondents? And then they say, thank you for your knowledge.
I'm looking at the question. Would they show age ranges, did you say?
Yeah.
Yes, I believe so. I think we're going through a lot of like secondary analysis through like our dissemination, and we'll be from what I can recall with like a lot of our like tribal communities that are interested in our data want to, like some answers tailored to like what they're asking for. So I could see them like see us doing like age ranges for like, who's smoking and who's not.
Awesome. Thank you. I see you probably are looking at the chat, but I will keep asking you questions. So Beth said, it is so beautiful to see an example in cultural integrity and respect. It's just asking about how we can access the recording later, but I agree. Mac, you did a phenomenal job. Are you all planning for formal presentations at conferences like APHA once you have high-level results available?
That is a great question. I hope Wyatt can answer that, but I would think that we would definitely be presenting though, more about like if information does become public like that. Our priority right now, though, is again, like going to the tribal communities and presenting the data that we've already, did some analysis and dissemination with. But I definitely could see that, though.
Awesome, thank you. Somebody asked if you're willing to share, what kind of healing slash growth did you experience personally through this project?
That's a great question. So going into starting this research project, again, I was born and raised in Apple Valley, Minnesota, which, if you guys don't know, that's a suburb. And I would occasionally go to with my mother to our reservation in Lac du Flambeau, Wisconsin, and that was kind of like the only exposure that I got amongst American Indian communities. And my first thought there going there was, that there's a lot of like poverty and, some drugs and violences that, I hear almost every day. But working with the community that I did, like going into this project, I saw that like I had like the same humor as them, and this just like a different connection that I had with them, like compared to like what I had growing up at Apple Valley or going to the University of Iowa with predominantly white school. And I thought, and I made a lot of friendships like in the last year, I would say. And I would say that that is just like that we have like a familial connection with each other doing these surveys and hearing their stories. And yeah, no, I would definitely say though that that there's a lot of like healing and growth through my experience with this project. So sorry, that was a kind of a long answer, but hopefully you got the gist of it.
Perfect. No, never too long of an answer. I have a follow-up question to that sort of. So you just talked about how this experience helped you grow and heal. What has been the hardest part of this process or this project?
Yeah. I mean, kind of going back to what I was talking about, like my reservation, for example, I think that is very like similar to some of these other ones with hearing some stories about like with like the historical trauma and things like that. And I mean, I've always read it in books, but it's always, to me, it hits differently hearing it told in a story form, I would say. And yeah, that's all I have for that one.
That was awesome. Thank you. Other questions from the audience? You could also feel free to unmute and ask Mac your question personally, if you prefer.
Bonjour, Mac. This is Madison Anderson. I have a question for you. I was just wondering, do you see yourself pursuing any sort of public health degrees, or I guess, are you interested more in the field of public health with this experience? How did this grow to your, I don't know, interests, I guess?
That's a great question, Madison. And I think I heard your voice before, but to answer your question, though, I would definitely say that I'm interested. As I didn't mention, though, I have my have a BA in Health and Human Physiology from the University of Iowa. Going into this job, this was during COVID too, and I didn't like really know too much about public health, and I didn't even know that I was going to be like communicating with my community the way that we've been doing. And I saw that like public health can help serve just, more than like one person. I can serve many people through like policies and just being able to open a bunch of doors in that way. And yeah, to answer your question, I would say I am interested, Madison.
Great question. Other questions for Mac? When people are pondering, we have a few more minutes, but when people are pondering, I would just like to share with you. Oh, Mac, I think you might have to. Yeah, okay. I'm going to share my screen, so it's going to kick you off. But I just want to remind everybody about some of our upcoming events and upcoming things about MPHA. So on June 23rd, we have our annual business meeting and award ceremony from 3:30 to 5 p.m. Registration is not open yet, but will be opening soon within the next couple of days. So be on the lookout for that. If you're not a member of MPHA, we highly recommend you become one so you can continue to support awesome presenters like Mac, as well as our leadership development cohort members as well. And if you are super curious about things that you can get involved with in MPHA, we highlight we advise that you join a committee. So we have a bunch of different committees. We have our health equity committee, our policy and advocacy committee, a bunch of different committees. So we highly recommend that you join, stop by one of those if you're interested in learning more, and follow us on social media. So you can find us at MN Public Health on all of our social media platforms. So hopefully during that time, you thought of more questions for Mac. And if not, this is a little reminder for all of you. So, any other questions?
This is Cheryl Lee. I don't have a question, but I just wanted to say that, you know, Mac, you did a really nice job, and I really appreciated the personal contribution that you gave, along with, you know, talking about the project, and you know, you kept almost all the people on throughout, you know, I mean, they stayed on till the end. So that says a lot as well. So thank you.
I appreciate your words, Shirley. And if you guys didn't know, Sherry was my mentor going through the leadership development cohort. And we were working on this yesterday, actually. But no, I appreciate everything that you've done, Shirley, and just being able to be flexible. I mean, here at ACAF, a lot has been going on with the work that we've been doing outside of TTOP as well. And I'm just, you know, glad that you've been flexible in that way. So thank you.
I see some questions in the chat, but I see that Beth has her hand raised. So Beth, do you want to ask your question?
Sure. So you shared that. First of all, thank you so much. This is great, and it'll be shared with my research department for sure. That said, you said that you learned a lot in this process about public health, about research, and all of that. Is there anything that you could share to people that are also new to this realm and like respecting tribal sovereignty over data and over their own bodies and everything, right? Is there anything that you would recommend for people to look into specifically, any resources that were helpful to you in this process? This will be a resource, by the way, but
Yeah, we have again, with what we're working on next is a toolkit. I think that there's some resources that we have amongst ACAF on like on how to communicate with the community, like with tribal communities. But I would say a big thing though, outside of like academia, is listening to like our elders, like on the like at tribal communities. I think that's a critical thing to be doing, and just learning from what they've been, you know, what they say and what they've been doing. I mean, they've been walking this earth longer than I have, and I think that goes a long ways. And everybody knows each other, I would say, amongst tribal communities. And just being able to make friendships with one, you're gonna make friends with 20 of them. So that would be my advice.
thank you.
Mac, you have a few questions in the chat, and I think they go hand in hand. So do you know if there are any future other plans to continue this in the future, and or do you think the study will be repeated?
I can't go like too much into detail of that, but we are like in the works for a study that's very similar to TTOP. So possibly a TTOP 3, if you want to say that. But we're going to have to identify new funders and things like that, because our previous funders was Clearway, and I don't think that they're around anymore. So, but I would be very hopeful though, and I would say yes. that we'll be repeating or doing a study. But also to answer Jaime's question for any other plans in the future, like again, we're going to be presenting this data again to the tribes. We currently are doing that and just helping them create resources and things like that on what this study has been, what we've collected. So yes, stay hopeful.
Awesome. Thank you, Mac. Does anybody have any final questions for Mac? If not, that's okay. I want to thank you all for coming. I want to thank Mac for a fabulous presentation. I'll clap for everybody. Thank you, Mac, so much. And thank you all for attending today. There will be a follow-up email with links to our recording as well as other resources. But thank you for attending, and we hope to see you soon at another MPHA event.